All right, everyone, welcome back to another episode of the All Me podcast. Excited to be here today. The Taylor Hooton Foundation is a leader when it comes to youth and adult influencers and educating them about the dangers of appearance and performance enhancing substances. And recently, we've noticed an uptick of parents that have emailed in asking us for help and resources because their teens are getting on testosterone. This is without a prescription. It's important for us to have an understanding of what these drugs are, why they're prescribed, and what are some of the downfalls to using them as a teen, especially if they're not prescribed by a physician. So today we have Dr. Richard Auchus, who is an expert in this field, to talk with us about some of the pitfalls of early life testosterone use. So Dr. Auchus, thank you so much for joining us and taking time out of your schedule to provide us some of your knowledge today.
Good to be here, Taylor.
Yeah, absolutely. So what I wanted to do was first talk about as the use of anabolic steroids and testosterone becomes more popular, prescribed or not prescribed, we wanted to have an expert that could provide valuable information for those that are thinking about using testosterone, especially without medical supervision. So you're a steroid biologist. Can you tell us more about your background and the work that you do with steroids?
Well, I am an enzymologist, and in my graduate work, I happen to be working on enzymes that metabolize steroid hormones. And so then when I went into my medical training, it was natural for me to do endocrinology. And then I started to take care of these. My interest is really more in people with disorders of steroid biosynthesis, genetic defects, and tumors that cause overproduction of things that cause hypertension and diabetes and things like that. But it also intersects on the reproductive aspects. And when I was in the Air Force, I actually was involved in this problem of anabolic steroid abuse amongst the military. And I was sort of the expert at the site I was stationed for people who were being reprimanded for that. And so I've kept this kind of peripheral interest in this problem of androgen abuse by recreational and professional athletes. And I'm also involved with the U.S. Anti-Doping Agency for reviewing their therapeutic use exemption. So I should make that disclosure.
Okay. Well, fascinating. So this isn't a new problem, but one of the things we're actually seeing is, while, a lot of adults want to use testosterone for various reasons, body image and low T and all that fun stuff, we're just sort of see this like trickle down to young people getting interested for whatever reason or not. And we just live in that world where people are influenced on social media. They're getting a lot of misinformation there. And often, they're looking to achieve this physical appearance goal in a very short period of time, which anabolic steroids, as you know, they work. That's what they do.
Right.
So I'd love to kind of just focus on, do these drugs affect an adolescent different than, let's say, you or I, if we were to use TRT?
Well, so, there are specific medical indications for this, and we do treat people, and we sometimes treat adolescents who have, again, genetic defects or tumors that cause them not to be able to make testosterone. But adolescence and teenage years is you make more testosterone during that time than any other time in your life. And it's a critical period of development for the testicular system to function normally. So when you take testosterone or any anabolic steroid from outside, it suppresses your body's ability to make its own testosterone. So you're basically during a critical time when your testicular system is supposed to be optimized, you're preventing it from functioning normally. And so you're setting yourself up for poor testicular function later in life. You're basically putting yourself on treatment forever. And I think, it may sound like not a problem now, but it is not easy to do this for the rest of your life. There are a lot of shortcomings with the way we replace testosterone. And so I think this is a very dangerous thing to do because, again, you're impairing your body's ability to make testosterone at a time when it's really trying to and where it's most able to do so.
What would be some of, maybe the short-term side effects that an adolescent might see if they begin using testosterone their own?
Oh, well, there's mood changes, and about 10% to 20% of people who take androgens, including testosterone, at high doses will have major psychiatric problems, such as manic episodes or psychosis, meaning they can't perceive reality correctly. And it's impossible to tell which that group of patients are. They can also get severe acne that leaves scarring on their face or their back. Will have problems with fertility later in life. So there are common side effects, but I think the main thing that I would emphasize again is that you're going to be impairing your body's ability to make testosterone later on.
So, and I'm just trying to, and it's really hard, as you know, you were a teen boy at one time, and it's really hard to sort of see into the future as to, what that looks like. But is this something, I know, again, I lost my younger brother, Taylor, after making an uneducated decision to use these drugs. And it was advised to him at the time, and he's 17, to just quit using the testosterone altogether. So you've got this 17-year-old young man, walking around with all these, mood swings from aggression to depression, but now ends up with low T. Right. Because he stops using them. But as far as like cardiovascular things, I mean, could this set us up for cardiovascular disease or anything later in life that maybe we're not thinking about at this time?
Yeah, so Aaron Baggish, who was in Boston at the time, he's shown that high doses of anabolic steroids, they cause a cardiomyopathy. They cause a stiffening of the heart, which can predispose people for heart failure later on. So, the heart is a muscle, and it responds to androgens. So there's a good side to that, but there's a bad side to that because the heart is also supposed to be compliant. So it becomes a thick, stiff muscle, which doesn't fill and pump normal. So it actually impairs exercise tolerance later on, the very thing you were trying to accomplish. So yes, that is, and of course, the sooner you start, the longer you are involved with this, the worse the problem is.
So yesterday, and it's so interesting, Dr. Auchus, because we've gotten just at least 3 or 4 emails already this year. It's February 1st, 2nd, 3rd, whatever day it is, right? And it's just parents that are reaching out because their teens are using testosterone. Right. Yesterday, I had a call with a student. He was doing a paper on testosterone use. And one of the questions he asked me is like, this is kind of perfect timing because I'd love to ask this gentleman tomorrow. But as a teen, let's say a teen male, what can a teen male do to ensure that they have optimal testosterone, production during that age so that, again, they're looking to grow their bodies. We live in a world where we're looking to get from point A to point B. Everybody wants to be bulky and this ripped look. But what can we do as young people to really optimize our hormones in a healthy way through food, diet, exercise, that sort of thing?
Well, so listen to your mother, because what your mother told you was actually all the points that I'm going to make, that you want to eat a good diet. You want to make sure you have adequate amounts of protein in your diet, and you want to get plenty of sleep. Testosterone is made most during deep sleep, REM sleep. So you want to make sure that you protect that 8 hours of sleep a night as best you can. So it's okay to stay up late once or so on the weekend, once or twice a month, but you want to make sure that you get 8 hours of sleep a night and undisturbed. You don't want to drink before you go to sleep because alcohol will mess with your sleep. So I think all those things are true. And then, of course, your people that are doing this are usually exercising. You want to get regular exercise. You want to listen to your coaches. You want to make sure you don't overtrain. And so all those things, and you want to make sure that you have a healthy body weight. People who are too thin, I was a wrestler, and some of the guys on the wrestling team, when they have to cut weight, that actually can impair testosterone production. Narcotics impair testosterone production. So don't do drugs. Don't drink too much. Eat a healthy diet. Have a healthy weight, and get good sleep every night. And again, I'm not telling you anything your mother didn't already tell you. There's no real secrets to this. It's just doing what your mom said.
It's interesting you say that. I smile because it's everything that we learn in school. But I think the problem that we're dealing with today, Doc, is you have a lot of people that are on social media, and again, they're in their 20s, 30s, and they've developed naturally, but you can tell that they're on gear. They're using steroids. They've got this physique. And you have these young kids, even as early as, we've had middle school kids asking us about different supplements to boost their testosterone because they want to look this way. So what's happening, I think, because as you said it, and I'd like to kind of go back to that for a minute, but let's say I'm 15, 16 years old and I want to get on testosterone, but I don't have any of these sort of medical issues that I might need testosterone. Is it possible for somebody to just go to their doctor and get on testosterone?
I hope not, but there are unscrupulous practitioners out there that will do this, and they do this to adults too. I mean, low T is not an indication for testosterone therapy. You understand that? Yes. So most prescriptions for testosterone are actually illegitimate. It has to be secondary to a medical condition. That's the FDA guidance. Testosterone is not just approved for a lab value. You have to have a pituitary tumor, chemotherapy, some reason for impairing your body's testosterone production. There are a lot of reversible causes. In adults, there's things like sleep apnea, which prevents them from getting good sleep at night. Again, chronic pain where they have to take narcotics on a regular basis, or they choose to take narcotics on a regular basis. So and then obesity is another thing that can, when people are overweight, that can impair testosterone production as long as strict dieting. So I think all those things that in society are fashionable now are not good for testosterone production. So I think, you're absolutely right that people are being influenced. No, you don't need to sleep 8 hours a night. No, it's okay to drink. No, it's okay to do drugs. It's actually not okay. So, so people who say this are leading you down a path that's only going to get you in trouble. And, I think one of the things you mentioned is that at some point you may have to stop taking it because you can't afford it anymore, because you're paying for it out of pocket. And that will precipitate depression and mood swings worse than the ones that people get when they start taking it. So the withdrawal is a real thing. And as you said that, and you've just impaired your body's ability to make it on its own. So now you're stuck. So I would just advise to, and the other point is I think people need to be happy with their own body. Okay. I'm a triathlete. Okay. I'm never going to be a bodybuilder. I'm never going to be a football player. So I do distance swimming and running and things like that, which I can do. So I do what I was made to do. And I don't try to do what I can't do. Okay. Yes. So, I still work out in the gym once in a while. I still try to, improve on my weights, but I know I'm not going to be able to squat 600 pounds like, some of the football players can, but that's okay. I just am comfortable with who I am. And I think that's, it's important for you to, take what God gave you and make the best of it. Yeah. But this is not the way to do that, and not by trying to be something you're not.
Yeah, I think the term is staying in your lane, right?
Yeah, right.
So, I mean, what would be your take where you have, like, for example, this mom yesterday, her teen son allegedly is using testosterone, was not prescribed by a doctor. Obviously, so this young man is purchasing them on the black market, which I want to kind of get your take on. But what's interesting is she's reached out to the primary care physician who has recommended to multiple doctors that won't treat him or talk with him because he's purchased them. So you really have no idea what you're buying. So what is your take on when these people, even adults do this too, but where they sort of skate the medical system and they go buy these black market anabolic steroids online or at the gym or wherever they're purchasing them from?
You should consider this the same as people doing heroin that's on the streets. I mean, testosterone is an addictive substance. It's a controlled substance, and that's why. So now you get yourself in a position where you have to do drug detoxification. There are some physicians that are comfortable doing this. I get asked to do this periodically. But with people who are taking narcotics, we have to have a contract with them that, they're not going to take them on their own and so on. And if they violate the contract, then we can't take care of them. And that's basically the situation you're going to get yourself in. You're going to have a contract with the doctor. The doctor's going to have to be able to control what's being done. We actually have pretty effective ways of getting people to start making their own testosterone again. They're all also off-label. We can prescribe them. We can do them for a limited period of time, and it's pretty successful in doing so. So I would say to the teenagers listening, if you've gotten yourself into a corner and you want to get out of it, it's doable, but you have to come clean. You have to go with the program. And, there will be a little bit of withdrawal pain, but you'll be much better off in the long run. So, you're no different than a heroin abuser if you're doing that.
And just so for the parents that are tuned in and that'll be watching this, where would they go? So this mom seems like she's doing the right thing, going through her primary care physician, but what can parents do once they've discovered, or hopefully their young person has trusted in them that, I'm using these types of drugs and I want to get help. Where can the parents go if they need help on this?
So that's a tough question. I would say that, starting with primary care doctor is the right thing. They may refer you to either a sports medicine professional who has had to do this or an endocrinologist who is skilled at doing this. One of the sad things about our profession is that with the explosion of the anti-aging clinic and the charlatans who practice against society guidelines and against FDA guidelines and indiscriminately give these anabolic drugs to people who ask for them for cash payments, is that the field has been now somewhat marred and people don't want to do this. People don't want to get into this. So there are still people who are willing to help, but you may have to travel a distance or do remote visits or something. But I think, starting with your primary care doctor, and then if they don't have somebody in the area to explore resources, for example, on the Endocrine Society website or the American Association of Clinical Endocrinology website, to find a physician as close as possible to provide guidance with the withdrawal phase. Because this is going to be a withdrawal phase, and just like a withdrawal from heroin. So there will be a little bit of discomfort involved. But again, once you get through that, you'll be much better off.
Yeah, and that was the advice that my brother got, and I believe it was from a psychiatrist, basically saying, hey, just stop using the testosterone altogether and this stuff will go away. Where, hindsight's always 20/20, right, Doc? So we look back, it's like, okay. And I've talked to, internal medicine doctors and endocrinologists and what have you, as we've learned things going forward. And many of them were like, well, likely that was a prescription for his death, because, you literally have a young man that's no longer putting this exogenous testosterone in his body, suffering from low T, and depression's very real when it comes to this stuff. So it's great advice, especially for parents.
There's not a lot of data to guide us on it, and I think there's no proof that one regimen is better than the other. And some experts actually do advise discontinuing it, but under medical supervision.
Right.
Actually, sometimes people need to be put on the antidepressants ahead of time for this, when they're going through, because they know what the mood changes are going to be. Yeah. And it takes some time for those drugs to work. So they may need to start it a few weeks in advance. But there is a group in the Netherlands who specializes in this, and they have a lot of anabolic steroid abusers that they've sort of coached down from the ledge on it. Unfortunately, they haven't published much on this topic. So again, I think because we're dealing with illegitimate use, it's very hard to legitimize the discontinuation of it. It's hard to study that scientifically and come up with guidelines and recommendations and standard best practices. But again, I think people that have done this for a while, I think, just having somebody to walk you through it is probably the most important thing, regardless of what regimen they use.
Okay. Do you see, as we move forward in the future, because testosterone is exploding and it's so popular right now. You can't get on social media or even the TV without being bombarded with a commercial, especially as a man, to get on TRT. And
they're also giving it to women too. But
yeah, exactly. Yeah. And so, but do you see, I guess, more studies being done on this going forward to maybe help physicians, be better prepared for a patient that comes in their office?
The problem's been around for a long time, and several of us have, written pieces on this. So I think there's information available if you want to get to it. What is disheartening is that the DEA should really be responsible for this, right? Because androgens are controlled substances, but they're so overwhelmed with the fentanyl epidemic, they don't have time for this. So the DEA has really done nothing to stem this tide. It's really their responsibility, because, these clinics that are indiscriminately giving out compounded testosterone products, that's a felony because it's a controlled substance. But I don't know of anyone that's ever been prosecuted. So it would be my hope that as the efforts to get the opiate epidemic under control are advanced, that then the DEA will have some time to start to prosecute these people and get this system under control. And then it will be difficult for people to get androgen products. And you're right also, you can get these things online from other countries and stuff, but you don't really know what you're getting. They can have anything that they want in it. There's no control. It's that is highly risky, and people have gone into liver failure as a result of taking, especially the oral drugs. Is very dangerous to get a medication that's not been made with good manufacturing practice, that's distributed through a pharmacy. That's really dangerous.
We did a whole podcast episode with the Digital Citizens Alliance, who are sort of like an internet watchdog when it comes to these types of drugs being sold online. And they purchase some of them and send them off to a lab to get tested. And the results, I mean, will drive your head bananas. Like, they're really putting this in their body? Like, yes, they are, because they don't know.
Yes. Veterinary compounds, things that are known to be toxins, it doesn't matter. It's not safe. It's just not. I mean, I think, it's, I do want to say that I do applaud the teenagers that are trying to, be athletes and advance their health and, all that stuff. That's all good, but this is not the way to do it.
Yes. No, I agree. And so with the years of knowledge that you have in the world of anabolic steroids, our audience is going to be a lot of younger people that we're talking to, but certainly some adults. So this is great information, but it's also imperative that we counter some of the misinformation they're getting online. So from your chair, what information do you think, if you had just one message to get across, would be most important with regards to using anabolic steroids without a prescription, essentially just self-medicating? What's that one message you would want parents and young people to know?
Well, I think what the people are saying is, no, this is fine, this is safe, and it's not. I mean, it's not safe. It's going to cause problems down the road, and they are addictive substances. So you're only going to get yourself in trouble. Even though you may have some short-term things that you want, you may get that high, just like when you take cocaine. It's a different kind of high, but you're going to come down from that high, and that's going to be terrible. And so I just don't start. Just don't start.
I've even had, I'll close kind of with this, but I've even had, folks that are in the bodybuilding world that have gotten on testosterone at a young age, or if you go out and read some of these forums, especially as males, and I know we've got a lot of females that are using testosterone, like hormone replacement therapy is a big deal right now, but they highly encourage young people. Like, I mean, if this is something you're really thinking about, don't start doing this stuff in your teens. And even when you're old enough and you're educated, just be very aware of what it is you're putting in your body, because like you've said, it's likely something you're going to be on TRT the rest of your life.
Yeah.
Very expensive.
Yeah. And it's not, and it's really not, we still don't have a good way of replacing testosterone that mimics the normal circadian biology. And so whatever we use, there are shortcomings and there are side effects. Even when we're doing it for good medical purposes, it's limited what we can do. It's an approximation what we can do. It's always best to make your own.
Yeah, exactly. Well, I can't thank you enough for doing this. This interview could not have been more timely. And one of the things that we're going to do is make sure, as we're talking with young students and that are hungry for information, or parents, we're going to be able to point them to this podcast to get information from an expert, somebody that genuinely cares about their health, so that hopefully they make a very educated decision to kind of push this to the side, focus on fitness, nutrition, weights, that sort of thing, before jumping into using, unknown drugs sometimes.
Yeah, if your parents want to get you anything, have them get you a visit with a personal trainer. I would do that instead. Because again, I think a lot of us don't really know what we're doing when we get in the weight room when we're kids. So yeah, get some professional help on that, not other toxins to put in your body.
I completely agree. Dr. Auchus, thank you so much for your time. We appreciate you joining the All Me podcast.
All right. Thanks, Don. I appreciate what you're doing.
Yes, thank you.
Okay, bye-bye.